My name is Joanitah, Nalubega, Nvannungi, and I'm a technologist. I work at Clark International University as lead administrative officer for the refactory program. We train software developers in the way that they should be trained. I graduated as an industrial chemist in 2013 from Makerere University, and I practiced with Decay's Chemicals for about 9 months. Now, the work was neither exciting nor providing opportunities to grow. And when I left that work, I took a job at Node 6 to get into website development, website management, content development and management, social media management. We did a lot of exciting things there for 2.5 years, and I have never looked back. When I left Node 6 in 2015, I took a course that was then called the Postgraduate Certificate in Applied ICT and Leadership at Clark International University, formerly International Health Sciences University. It was a 6-month course where we delved into ICT for development, basically how to use ICT to solve some of our biggest community challenges. I stayed on that program as a mentor then, a mentor and an intern to help with the administration and the development of the program. While in my first year of that work, that was in 2017, I encountered a couple of students who were on the program who proposed a solution to the challenge of medicines management, drug and supply stock in one of the pharmacies that they were working in. First of all, Drug Dash is a web and mobile application that gives real-time visibility of the supply and demand of drugs across the district, like within the district. So a district health officer or whoever the medicines manager at that level is able to see how drugs are being consumed and how they're being ordered in the district at all the health centers within their jurisdiction. So the idea is to prevent overstocking of supplies and understocking, and sometimes some of these things also result in, of course, expiry of drugs that costs money to destroy or to dispose of. And so starting last year, we received extra support from UNFPA, still without box, and we were able to implement Drug Dash in 25 districts, in 25 health centers, health center 3s and 4s, in Bukedia district, Bulambuli and Kwen districts. All these are in eastern Uganda. At the moment, we are seeing much better, first of all, management of stock of medicine, but the district health officers in those districts are able to redistribute medicines inter-district and intra-district. As such, we have seen at the moment, we since November until this point, we've been tracking family planning supplies, and we've seen a decline in outstocking, first of all, and then excesses of certain supplies at particular health centers. But even when those happen, now they're able to just move them to a place where they're needed the most. So we have registered good success with the implementation of Drug Dash. However, we have also found that as much as the intended users, so for example at the health centers, the intended users are eager and willing to take the product, there's been challenges in capacity. So technologically, some places you may find that there's computers or mobile phones for them to be able to use the product, but they'll have a challenge with network, or they'll have a challenge with internet, or the availability or even affordability of it. And then the other issue sometimes is buying of the technocrats, the other stakeholders who then sign off. They are a lot more reluctant than the users who are ready to go as soon as the products are introduced to them. So red tape, bureaucracy, because we are working mostly in the public health sector. So like all other homegrown business support solutions, data center hosted locally, one, if it can provide affordable and reliable services to tech startups, is a great addition, or is a great resource for us, because at the moment we are hosting data outside of the country because that's what you can afford, but that's also what you can rely on. So of course I understand that services like yours have to be built upon good basic infrastructure, like electricity and all the other things that are probably the responsibility of the government. But when that's in place, affordability especially, and then reliability, then services like those that exist at home are a great resource for us to be able to have our data where we can access it when we want to access it, to make better decisions for our businesses. So the opportunities in tech are really just opportunities to solve problems that we live with. And living in a low-income country, we are not short of problems to deal with or to solve. So I believe that women have an opportunity today to address so many gaps or challenges in service provision that have existed for centuries, because they have the training and access to opportunities to be able to close those gaps, to address service provision gaps where women and other disadvantaged, say, groups are afterthoughts. In technology, for example, we have an opportunity to now deal with those things that maybe male creators or innovators of certain services and products did not have in mind. For anybody that's trying to get into technology, I'm not sure why technology is an industry on its own, because really it's just an enabler for life, for all other industries. I say find a challenge that people are actually facing, not one that you imagine people are facing. Find a challenge, seek a human solution to it, and then technology will just come in to make that better, or to make it faster, make it accessible or reliable. But at the end of the day, solve a problem.